Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast, the podcast designed to help you feel, see, and think differently about the podiatry profession. With me today is Dr. Patrick McEnany, and this is his fifth appearance on the podcast. Previously, it was on episode 48, he was talking about rapid business expansion. Then episode 74, and it was 8 business tips during COVID-19. Episode 108, which was you can't manage 10 clinics yourself. My God, I'd hate to be doing 10 myself. And the last one, episode 214, which is in the top 5 of all-time downloads for this podcast, was when buying, it was what to look for when buying a clinic. So Patrick, welcome back to the show. You are a popular guest.
Well, thank you. I'm always happy to be in and talking to you.
And did I mention, and he's from Northern Illinois Foot and Ankle Specialist. So if you're in Northern Illinois at any time, give Patrick a call. He will come and meet you and greet you.
I'm always happy to sit down and talk to people. It's fun to share my experiences because I know that sometimes things we talk about spur ideas and help other people develop their practices and the way they treat patients.
Well, the amount of feedback I've had from your episodes and some of the other episodes, sometimes people really grip onto something that's business related, and other times they gravitate towards like career advancement as well. But even some of the episodes where I've just had younger and new graduates on have been really popular. So it's surprising the stories that people are enjoying.
Yeah, I think podiatry has a diverse storytelling to be on and to have people listen to.
It's because it's a good profession. And anyone who's listening to this, who's going, I'm not sure if I should stay in podiatry, stay in podiatry. Go back and listen to 270 something episodes and you will stay in podiatry for sure.
I've been very successful in podiatry, and I think that I still think it's medicine's hidden little secret. I think there's a lot of room for growth in these practices. In Illinois, particularly, a large amount of doctors are retiring, and we have a very disproportionate amount that are older versus younger coming in. And so, in Illinois, there's been kind of a drift of doctors leaving to go to other states, and because of that, it's kind of left us with a void, and especially in certain regions. And besides the systems we've set up and the doctors we have and the treatment we give, having it where there's not a ton of people, competing with you is also very helpful for business.
Yeah. But the same thing's happening in Australia. There seems to be a disparity between the newer graduates coming through and the people that have been in the profession 20 plus years, and their training and the direction they want to actually take the profession. And I think it gets a little bit cloudy sometimes for a new graduate who comes out, and depending on where they work, who they work with, I think it's one of those things where if we could all get together and sort of go, I like doing this part of podiatry, and somebody else says, well, I like doing this. Not one's better than the other, but what about if we actually referred to each other and actually work together, like how the doctors do it with other specialists?
Well, I mean, dental's a great model for this.
Yeah.
So, in America, and I don't know how it is in Australia, but, you go to the dentist cleans has your teeth cleaned. He does cavities, he does crowns and stuff like that. But when you need, wisdom teeth pulled out, it's not your dentist who does it. You go to the oral surgeon. And, the oral surgeon doesn't sit and do all the work that the dentist does. He sends all that back to the dentist, and the dentist refers him. Then the orthodontist does a whole different set. And so you don't have a dentist who's trying to do all three of them. And so within our practice, that's what we're trying to do. I had a conversation last night with a podiatrist that, is around my age, only does primary care podiatry and doesn't want to do surgery and is happy doing that. And, some people look down on that and say, well, this person doesn't do everything. Well, in my world, that's great because I do a lot of surgery in my practice. And so because of that, this guy can take over and potentially do all the other stuff that it may be distracting me from, my surgical goals.
Yeah.
And so, and then I have, other podiatrists who call up and say, I want to do a lot of wound care. And we say, great, we'll give you this type of practice. And then when they have somebody that needs surgery, they kicks that back over to us. And I think if the doctors looked at things that way, I think they'd all be a lot happier, because usually the people who want to do a lot of surgery are always struggling to get the surgical numbers they desire. And the best way to do it is to have people who are feeding you.
I think so. I just had lunch recently with two podiatry students who are graduating this year, Evelyn and Sophie. Give them a shout out. And Evelyn is more geared towards, general foot care, high risk feet, and she really enjoys that area. Whereas Sophie was more towards biomechanics and sports. So they've both gone through podiatry at the same time, but they've developed their own interest. Now, what I think is interesting, 5 years down the track, if they both had their own practices and they weren't far away from each other, they could have an awesome working relationship. And I think the thing that ties them together, though, I think biomechanics is the part that ties everything together.
Of course, and I think a lot of people don't realize that, people want to do a lot of surgery and they don't realize that, surgery is knowing what the biomechanics are before and after you've operated.
Yeah, and that's what I was saying to them, that I was saying to Evelyn, you might like high risk feet in general foot care, but there's always an underlying biomechanical, there could be an underlying biomechanical aspect that you need to look at. So you can take it so far, but then if you get someone who needs more, you then refer them on to Sophie, who really enjoys that at a higher level. But then Sophie in reverse, if she saw somebody who was a sports patient, but then noticed that they needed routine foot care, could refer them onto somebody else if that's what she chooses not to do.
Well, and we see this, in my area, I have docs that, do some surgery, but don't do everything, and, what they'll do is they'll refer the stuff to me, the patients who need, let's say they have an ankle fracture and they don't do ankle fractures. So I'll fix that. But, then I make sure that, okay, if this patient needs an orthotic afterwards, I'm not going to do the orthotic. I make sure I refer them back to the doctor who, they came from, so that I'm not stealing patients for them and I'm not, kind of stepping on what this relationship we have. But what I've seen at times is people get greedy and they kind of just treat it as their patient. They don't earmark it in their head that this was a referral and I'm supposed to send this back when I'm done. So you can foster those relationships as long as you set up clear boundaries with the doctors you're working with and explain to them, all right, here's what I'm going to do. After this, it's your patient. Everything goes back to you.
Yeah, and I think that's a really, really good point. So since we spoke last, which was July 2022, and up until that, I think you had 14 clinics at the time then?
Yeah.
How many do you have now?
Well, I still have 14, but there's an asterisk on that. There's an asterisk on that. So I purchased two clinics that were within a few miles of each other. And it was interesting because I had Dr. Lenny Vekos and Dr. Jeffrey Mackler. They used to work together 17 years ago. And so I purchased Dr. Mackler's clinic. And, I was, we were going through stuff and I was looking over his lease. And his lease was up in I think like 4 or 5 months. Well, Dr. Lenny Vekos, I wound up purchasing his practice several months later. And what we wound up doing is merge the two clinics together because they were so close.
Yeah, that makes sense.
And so, you cut the overhead, you cut the staff you need. And these two guys had worked together for 17 years before they split and went on their own ways. And so kind of brought them back together. And Dr. Mackler, like we were just talking, does primary care podiatry. And Dr. Vekos does, a lot more surgery and involved stuff. And so now they're able to kind of refer back and forth to each other. And, we've kind of refostered that relationship between the two of them. And that's been helpful.
And they're probably loving it.
Yeah, it's great. It worked out perfectly for both of them. The other thing that we did was one of our clinics, we bought another clinic that was down the street from it that was attached to a hospital. So we moved those patients to the other clinic.
Okay, that makes sense.
A lot of what we've been working on is kind of, as we purchase some of these clinics, we look at our footprint and say, okay, let's consolidate these two into one. We have less overhead and we can have kind of more patients in per capita. And that leads to, better profits.
I think that makes sense because I think sometimes podiatrists, I'm not sure about America, but in Australia, it's like a badge of honor to have multiple clinics, but some of them aren't the greatest clinics. They're working there 1 day a week, and over here they're working 2 days a week. And instead of really having 5 clinics, they've got 5 part-time jobs, and they might have a couple of other podiatrists working in there. But some of the clinics aren't that far away from each other, and they would be smarter to pull them together.
Right, and what they do have is 5 overheads then.
Yeah.
And so we've kind of looked at it, but you have to be careful because you have to know the areas. So, in one of my areas, I have patients that are 2 towns over that won't cross a certain bridge to come to our town because it's not as uppity as the other clinic is.
Yeah.
And so I'll have some people that'll go this way, but I have patients that won't go this way. So you can't just willy-nilly take these clinics and say, okay, I'm just going to smush them together and everything's going to work. You have to know the dynamics of the neighborhoods. You have to know what type of people are there, and you have to know kind of the traffic patterns and where people go. If someone from this town goes here for groceries, they may not go the same distance the other way.
Yeah, it makes sense.
And so that's the key thing is really knowing these neighborhoods. And that's why, some of these private equity groups that go out and buy things, they go, okay, we're going to buy this and we'll push this here and put this here and move this here. And on a map, it looks great. But if you don't know the population dynamics, you may be faltering.
Yeah, well, I remember that when I had 2 clinics that I used to visit up in the Tablelands, which is about an hour away. One was Atherton and one was Mareeba. Both small towns on the Tablelands, about the same size, 20-minute drive apart. And it was a really simple drive, pretty much flat road, wasn't hard to get from one to the other. But I didn't realize the 2 towns were so competitive to each other. It was sort of like, which town is the capital of the Tablelands? And because they both had football teams, they both had soccer teams, they were, competitive in so many different ways. And because Atherton was green and Mareeba was brown, because it was just, like a drought area, I didn't realize until I worked up there for a while that, wow, these 2 places are so different. And then if there was a certain day I'd change that, I decided I'm just going to work in Mareeba this time, and I'd ask the Atherton people to come over, they go, I'm not going to go to Mareeba. Okay, it's 20 minutes away. They go, I would rather come to Cairns than go to Mareeba, which was an hour away.
Well, and again, it's what we were just talking about. You have to know your population dynamics before you start shifting people. And this happened to an orthopedic group in our town. They had 2 clinics that were kind of in a different area. They merged the 2 together into one spot, but they didn't realize that there were patients coming from way over here, off camera, I guess. They were coming all the way over to here, and this may have been a 40-minute drive, and they weren't going to drive the extra 20 minutes. And instead, they went the other way. So it's not that it can't be done, but you have to really be aware. And part of what I do when I look at these is, before I do this, is I look at where the patients are coming from.
Yeah.
And, if you have a lot of patients that are coming from far away to this clinic, you got to think, are they going to drive that much further to the next clinic?
And it's also and it's not just distance, it's the difficulty in driving sometimes. Like where I live in Cairns, I'm in about 10 minutes south of the city. To go to Atherton, I can go up this range called the Gillies Range. I think there's 324 bends in 15 kilometers.
Okay.
If I go to Mareeba, you go up the Kuranda Range, which is a nice winding range. It's a really easy drive. So a lot of times when I'd go to Mareeba, if I was going to Atherton, I would rather go the Kuranda Range, which took me 20 minutes longer, but it was an easier drive.
Yeah.
Because the Gillies Range, we went up there a couple of weeks ago, and every time you do it, you remember why you don't like going that way.
That's like driving to the city in Chicago.
Oh, it's just, once you start, you're going, oh yeah, this is nice for the first 120 bends. But then you're going, is this ever going to end? I know it's only 15 kilometers, but it is a hard 15 kilometers. So like you said, if a corporate was looking at 2 clinics and go, oh, we're just going to make these people here go to there because it's only 15 kilometers away, but they don't realize it's a tough 15 kilometers compared to going 40 kilometers in a different direction.
Yeah. So it's that you got to look at, how busy the roads are. Certain people don't go onto busier streets. And again, all this is just, the more you know these towns and how all this stuff works, the easier it is to make those decisions.
So what, I forgot what I was going to say then. That's all right. Bit of a cough happening at the moment. What's that? Oh yeah, they'll edit that part out in the podcast. People watching the video will understand. They'll probably see me coughing a few times. I wouldn't have heard it, but they would have seen me coughing. So with the clinics you recently took over, you brought these 2 guys together. Are you planning to do that with some of the other ones, pull them together, or they're strategically in a really good spot?
I think right now where our pattern is, I think so far things are going good with them. But if I pick up other clinics, because I'm always talking to people, you kind of have to look at that strategy wise. You can pick up a clinic and merge them, but if your lease is another 3 years that you're taking over from
Yeah.
somebody, then you've got a different issue. And so, I have offices that are 10 minutes, the 10-minute drive apart, and both of them are thriving.
Yeah.
And so, if that's the case, then there's no reason to mess with something like that.
Oh, yeah. If
But
something's working, don't mess with it.
right, right. And I think sometimes people try to do stuff like that and think, well, I can squeeze a little bit more out of this, and it may not work that way. So it all depends on how clinics are producing, and again, where the patients are coming from. And I recommend that if your clinic's getting busy, and if whether you have one clinic or have a few, but if you're getting to the point where you're thinking about adding one, look at where your patients are coming from. Because when
Oh,
I
definitely.
went from my first clinic to my second clinic, one of the things that happened is we were getting really, really busy, and we didn't have enough room for everybody. So what I did is I actually looked at where all our patients were coming from. And I saw outside of like the surrounding towns that, like a few towns over, this was where a chunk of people were coming from. So it made it real easy to add that next clinic, because I knew I could fill it right away and decompress the one clinic while getting a kind of a starter at another one.
Yeah, I did a similar thing myself when I had the clinic in Cairns. We had a nice sized clinic, but it sort of got to capacity where we were really busy, couldn't find any more room. And we did the same thing. We mapped out the area, and over a period of time, we said, okay, where are our patients coming from? We eventually set up another clinic, Smithfield, which was a 25-minute drive. And that went really well for about 5 or 6 years. But then I moved my Cairns clinic, bought our own building, and it was like double the size. And I'm thinking, I've got this massive clinic with all the toys. Smithfield was going well, but didn't have all the toys. So we financially looked at the numbers, and we thought, well, let's close that down now, because we set it up for a particular reason. That reason doesn't exist anymore. So we brought the people back in, and probably about half the patients came back to see us, and the other half sort of dispersed to other clinics.
Yeah, and again, these are all business decisions that people shouldn't take lightly. You have to really sit down and evaluate the situation, and if you're not sure, ask someone to kind of analyze and help you look at all this stuff.
Mm.
Because what you don't want to do is shut down a clinic and then nobody comes over, and you've basically just thrown away a clinic. But sometimes consolidation can lead to increased margins.
Oh, but as soon as we amalgamated both the clinics together, the main clinic, instead of just 50% from the other clinic coming over, but the whole clinic itself just grew massively over the next 3 years, because we were focused on one area. And I've had coaching clients who've said, oh, I'm looking at setting a clinic up in this other town. Great opportunity. They get patients from that area. They were pretty pumped about it. I said, okay, if you do it, let's look at the numbers. If you do it, what happens if one of your podiatrists leave? Oh, hang on. Yeah, but no, that's not going to happen. I said, but what if they did? If they did leave, would that put any stress on you and your other team members? I went, oh, it'd kill us. I said, well, I would probably suggest not doing it at the moment, because you're not sure. Anyway, 3 months later, it might have only been a month later, an employee resigned because their partner got moved somewhere, so they had to leave. And they just went, my God, I'm so glad we didn't expand to that other clinic.
And you have to be prepared for these types of things. So, I'm always talking to doctors. I'm always kind of, even if I have doctors say, hey, I'm looking for a job, I'll interview them, even if I'm not looking to hire. And I keep their information. I'm honest with them, and I'll say, listen, I don't have an opportunity for you yet. I like you. I'm going to kind of keep you in my bullpen. If clinics start to get busier, if someone decides to move on to another opportunity, if we decide to buy another clinic, I'll call you. But I kind of keep that line of communication open, and this is even with all my staff. We're always interviewing. If I don't need another receptionist, we're still interviewing for them.
Oh, good idea.
Because you may find somebody, and they may not like their job. They may not find something else, and you may call them in 2 months and they may jump at the job. Otherwise, sometimes you'll interview, and there's been times I've interviewed doctors and I go, wow, this doctor's good. I have to have them. And I'll hire them, bring them in. I'll even cut my schedule if I have to get them fed and get them started, knowing that this person is going to retain patients, and that the patient is going to be a star within the practice. And I think that Sometimes people don't realize how the success of the practice really depends on how good the doctors are. And I'm not talking about just good from a medical perspective, but I'm talking about good with working with patients.
Yeah, good people.
You know, you can be a horrible doctor and patients can think you're great, and they'll keep coming back and see it. Yeah,
And everyone's
you
heard
know,
that story where they'll go, oh, the podiatrist down the road, he is awful. But the guy's got a thriving practice, or girl has got a thriving practice. And it's because they are really good communicators.
yes, and I think that if you're not a good communicator, you know, if you're you know more introverted and don't like talking to people and don't like having conversations, I think you know there's no harm in even taking classes or talking to people who specialize in this.
Mm.
And even like learning to read body language of your patients. And this is something you can learn if you don't think you're really good at it.
Oh, you can definitely learn it. Have you heard, talking about the employment side of things and having extra people on board, have you heard the military term 1 equals none, 2 equals 1?
I have not.
Or 2 equals 1, 1 equals none. And what it's all about, and I think I heard this the first time when I was at Business Black Ops. We had Jocko Willink came in, he did a talk and had lunch with us, but it was something that came up often. Every year it's always mentioned. And what they talk about is in the military, a soldier or Marine will never go into battle with one weapon. They'll have their gun, their rifle or machine gun, but they'll have a sidearm, they'll have a knife, they might have a baton. So they've got different weapons, because if all of a sudden the rifle fails, if that's the only thing they're going to battle with a rifle and it fails, they're up shit's creek without a paddle. That's the problem. But then they've got the sidearm. But then if the sidearm runs out of belt, they've got their knife. And they reckon it works the same if they go, I was going to say if they go to the outback, but you don't have the outback over there. But if they went out bush,
It's a restaurant. It's a restaurant though.
But if they went out bush, they don't take just one way of making a fire. They'll have multiple ways of making it, because and the idea behind it is if you only have one way of doing something and it fails, you've got nothing. But if you have two ways and one fails, you've always got a backup. And I think that applies sometimes within your business. It's always good when you can, by looking at the numbers, having that additional staff member. Because if somebody leaves, holidays, whatever, accident, you've got that extra person.
And within my staff, we have over 100 employees. So we always have backup people and
yeah.
But even if you're a smaller practice, instead of having that extra person, potentially you could have someone who's cross-trained. And, we do this in some of our smaller clinics that are further away from here. Well, you may have your front desk person and your medical assistant, but we may cross-train both of them so that if somebody's out sick, at least somebody's able to cover to some degree.
Yeah.
And you're not left like, well, I don't have somebody answering phones today, so we'll just let them ring.
Yeah. And I also think it's also, as a backup, you need to have strategies and systems in place that when shit happens, and it does, you don't even have to think about it. The whole team knows what we're doing next. So a staff member rings up at 8 o'clock and says, I can't come in today. I've had a car accident. Car's buggered. I hurt my leg. I'll be in tomorrow. And all of a sudden you've got 20 patients booked in that day. What do you do? And you shouldn't even really need to think about it. It should just be an automatic response. This is the steps we go through. This is how we solve that problem.
Well, and to, even if you look at, high schools in the US, we have fire drills, we have, tornado drills, and they run the kids through them, a few times a year. So the kids, have that muscle memory and know exactly what to do. And to some degree, you don't have to go through it, but if you have it, the algorithm put together, if this is what we're going to do when this happens, it makes it real easy, and your staff doesn't sit there questioning you.
Yeah, it's one of those things that it's all. I did a talk a while back called preparedness, and it was really just preparing for when things happen, because they always do. And that's why I'm always shocked when somebody says, oh, I'm having a terrible week. Podiatrist left, or they've gone on holidays, or there's been a family emergency and they've had to go away for a week. And all of a sudden they're like, drop the lolly bag. They don't know what to do. I'm going, you should already have things in place that if this happens, we do this. When this happens, we do that. and it's just automatic. It's inconvenient and it's a pain in the ass, but you've already got it all well thought out.
And I think the excuse a lot of people always say is, I'm too busy to set this up. I'm too busy to put this protocol together. But then what happens is it takes you 2 or 3 times as long when the problem actually happens.
Yeah, we used to have a disaster folder that I'd set up, and it was every possible thing that could go wrong was in the disaster folder. Whether you walked into work and there was no power, or there was a plumbing problem, or a piece of, a major piece of equipment broke, or the milling machine wasn't working. And as soon as it happened, everyone just straight to the disaster folder, boop, 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 went through the steps, and we just moved on. We weren't sitting there all looking at each other going, oh no, what do we do now?
Right. And what I've seen, like when you don't have this preparedness, what happens then is instead of one person handling the situation, everybody tries to handle the situation. And then you have people doing conflicting things. And we've had this happen where, there's like a problem with the toilet. And literally instead of calling the manager, someone calls the manager starts getting someone over, but then the front desk person's calling someone too. We've literally had 2 people show up at the same time, and we're like, why are you calling? Well, it was broken. I just figured I'd help.
Yeah, that's exactly why you need this.
And so putting this together and what we like to set up is we set up like, all right, this goes out, this is the vendor we use. This goes out, this is the vendor you use. Well, this clinic's a little further away, so these are 3 clinics we call this vendor, this one we call this vendor. And if you put all that together, you're able to have this so that you're working with the same people every time. And you're not sitting there, well, the water heater's out. You've called 3 different people, the last 3 times, and the one guy doesn't know what the last guy did.
Yeah, it's true. But it's one of those things I always talk about, digging the well before you need the water. And I think it's important, especially if you're a solo practitioner, is to try your hardest to have a good relationship with some other podiatrists in your area. Because if somebody did leave suddenly and you were left in the lurch, if you rang 2 or 3 podiatrists and said, I'm so busy at the moment, I've had somebody leave, someone's called in sick, there's been an accident, is there any chance you've got a day spare for the next 3 weeks? I'm sure if you were friendly enough with them and they were not flat out themselves, they would be able to help you out.
Absolutely. And one of the things I do when new podiatrists move into town, I usually meet with them. I'll say, hey, let's go do dinner, and I say, hey, this is the type of practice we have. These are the types of things we do. Tell me about your practice. I let them know, if you're ever doing a surgery and you need another set of hands, if it's a complicated case, we have other doctors who are, able to jump in and assist you if you need it. If there's any problems, concerns, with patients, let us know. And, and then, you kind of keep these lines of communication open because it can only help you,
Oh, definitely.
Podiatrists, especially years ago, were really known to kind of eat their young. They blocked people from getting onto hospitals.
Yeah.
They would, try to prevent people from moving into town and this is my land, stay off of it. But, I think that there's enough room for everybody and there's enough patience for everybody, if you guys are respectful of each other.
Yeah, no, I totally agree. And it is one of those things. I've had a lot of podiatrists recently who say, oh, I'm not very well networked. Well, get networked. Go to events. Right. Jump on online groups. Yeah, there's so many like online groups where all you got to do is post comments. When somebody asks a question, post a comment and always make it positive. Don't be that troll that when people see their name pop up, they go, oh shit, what are they going to say now? and it's just all of a sudden it's like, blah. It's like verbal diarrhea, just constantly comes out. That type of person, when they're in strife and they put their hand up, nobody's going to help them. Everyone's just going to turn a blind eye. But the person who is always positive, always willing to give a hand, suggesting different things, when they're in strife, people will put their hand up and help them out every single time.
Well, you reap what you sow.
Oh, definitely. So what's the plans? What are you doing? Well, actually, before you get on to what you're doing next, I just want to go back a step. With your expansion you've done over the years, with buying other clinics and amalgamating different things, I assume you, when it comes to looking at your numbers, you are a crazy man.
Well, you try to keep abreast of all kinds of different numbers. And data is really key. I mean, if you look at what's
So
going
what are
on.
the key numbers? What are the key numbers that you actually look at?
So I think the lifeblood of a practice is how many new patients you're seeing a month.
Yep.
And so that's a big thing for me is if your doctors, aren't seeing new patients, then they're stagnant. You have patients, and if you're seeing just follow-up visits all the time, those patients at some point aren't going to need to follow up anymore. And so who's going to backfill those patients? And so, your patients you're seeing today are going to be your follow-ups a month later. And so that's probably my biggest number. I look at overall patients that are being seen by each doctor and by each location, which, are different types of numbers for me. The number of patients you're seeing in a practice kind of gives you the idea of like what kind of capacity the practice can handle. And, you can look at, the number of staff you have. And if you see a trend that you're seeing more and more patients, you'll start saying, hey, the medical assistants are running real hard right now. I might be at the point where I need to add somebody else.
Yeah, that's a really good point. That's why you need to. There's been a few podiatrists recently that will be posting job ads, and they'll put, "We don't keep KPIs. We're patient focused." And I'm like, seriously, how can you run a business if you don't have key performance indicators? And also looking at how many new patients are coming in, that's a key performance indicator of the practice and the business owner. So if they're not even looking at that and just flying by the seat of the pants, oh, but we're booked out 4 weeks ahead. That always worries me when I hear that.
Well, and patients aren't going to wait that long. In
No.
my area, if our patients, call up, and if they can't get in today, they'll call in somebody else and get into somebody else today. And so, there's practices that may not be as busy in some of our areas that may get some of our patients if we don't have the availability. And I've had patients that I've seen for years, and all of a sudden they get injured, and to them, they hyper focus that I have to see somebody for this today. And if I don't see them, they're in urgent care or another practice. And so one of the things we like to do is to try to leave, at least 2 visits a day per doctor, where we have, we call them hold for same day.
Yeah.
And they're for people who have an infection. They're for people who have an injury, or they're for new patients who call up the same day, with something that seems more urgent to them, not in general, but to them.
Yeah.
Because then we can get those people in and they're like, wow, I got in same day. I've called different doctors for myself and they're like, yeah, he's booked out for 3 months. If you're booked out for 3 months, you need another doctor.
Definitely. But I did a marketing talk a couple of years ago, and we're doing another one in Chicago on the 21st of August. 21st of August, that's wrong. And we're doing another one, I'll repeat that. We're doing another one on the 21st of October in Chicago. So I'll probably catch up with you around then anyway.
Sure. Yeah, we'll have to sit down and talk again.
Yeah. So, but what I was going to say is I did a marketing talk a few years ago, and at the marketing talk, I mentioned, I have this one ad that whenever you run it, guaranteed 100%, you will get a number of heel pain patients coming into your clinic. Guaranteed. Always works. Somebody came up to me afterwards and said, can I get a copy of that ad? I went, yeah, okay. So I gave them a copy of it. They sent me an email 4 weeks later and they said, your ad doesn't work. I went, oh, that's surprising. I've used it for 20 years and every time I've run it, it works without a problem. And then I'm talking to them, saying, well, tell me what happened and all this. And then they said something about, and I thought we would have got more, even though we're booked out 4 weeks ahead. And I went, well, hang on a sec. I said, people have seen this ad about heel pain. They've got heel pain now. I said, so you've run this ad, they've run your clinic, and they can't get an appointment. Or no, but they could get one in about 4 weeks. I said, they don't want to wait 4 weeks. They need an appointment now. So all you've done is run an ad to help out everybody else in town, because they would have rung you knowing that, yes, I do have that problem, can't get in. Okay, well, I'll go somewhere else who actually has their schedule sorted out properly.
Right. And this is something that, I look at too when we're doing our advertising. If I've got a clinic and it's really, really busy and there's not room for more patients, then you got to turn down the volume on your advertising spend.
Yeah.
And you may want to then turn that down and save that money for your slower season. For us, February is one of the slowest times of the year. So, what we do is we turn up our advertising dollars in January and February so that February is a lot busier. If we're really busy in July or really busy in December, then, why do the whole spend as high during those months? Because those patients can't get in anyways.
Yeah, whereas over here in Australia, December and January into February are probably the 3 busiest months. We always had super busy months. I assume you are quiet over there because people are going to get through 10 feet of snow to get out of the front door of their house.
Well, but it's a little different by us because November, December tends to be real busy because people have insurance deductibles.
Yeah.
And so, if anybody's in areas where they don't have, the private insurance type of system like we do, people have to, meet a certain deductible, which could be $1,000, could be $10,000 that they have to pay out of pocket. And then once they meet that, then stuff may be covered at 100% or covered at 80%. So what happens is people meet these deductibles, and a lot of them, not all of them, but a lot of them go by calendar year.
Yeah.
So for us, like if you've met your deductible, let's say you were hospitalized for something and you've met your deductible and now you need bunion surgery or you need a new pair of orthotics, they try to get in before the end of the year because then they don't have to pay for it.
Yeah, that makes sense. Well, in Australia, all our health funds usually cut back in on the 1st of January. So if you haven't used your cover that year, then you lose it. So December's really busy because we do a lot of marketing November, December, reminding people, hey, your health fund's there, use it or lose it. Then in January, 1st of January, it cuts back in. So then we're reminding people, hey, if you came in last year and got orthotics, you can come back in January and you can get another pair. You don't have to wait 12 months if you're finding one pair is a bit of a pain. And so it is. Every country would have those same peak periods. But if you're booked out 4, 6, 2 months ahead, you're totally missing out on a lot of good patients.
Well, and I think that, you also have to, when you do your advertising, whether it's print, whether it's other types of media, you have to tailor it towards your season. And I know people that put up an ad and it's the same ad every single month, for the last 5 years, it's the same exact thing. And a lot of times, especially these days with everything being digital, you can have 12 different ads on 12 different months and be advertising different stuff depending on what the season is. When it gets warm out here, because it's not always warm all year in Chicago, we have people when it starts to get nice, they start getting more repetitive athletic type injuries. They get, sprains, they get, they get plantar fasciitis, they get tendonitis, they get joint pain because they're out running, they're out working in their yards, they're doing things. Those types of ads are totally different than my slip and fall ads that, come in when it's snowy out.
Yeah, we used to have an ad that ran every January, February, and it was the party's over and it's time to exercise, but are painful feet and ankles stopping you? If so, you need to call the foot doctors at Pro Arch Podiatry, and then it'd have our details. It was a 15-second ad. We had a video, we had print, we had online. We pumped the stuff all around the place. And that's why January and February went so well, because that was like our main marketing campaign. And we did it for about 5 years in a row, every year. And as soon as it got the end of February, we stopped it and moved on to something else.
And it's important to kind of divide these up, and you also have to look as if they're working. You may think in your head, this is a great idea. I love this idea. It's going to kill it. But when you look at your numbers, you may say, this didn't perform well, even though I think it was great. Yeah. And I think that sometimes our egos get in front of us and we just say, oh, this is a great idea. Let's do this. And then you're like, oh, I saw a bunch of patients, so it must be working. And you may look at the numbers and say, actually, our numbers were the same as last year when we didn't do this advertising.
Yeah, I remember 20-something years ago, I went to this one event that totally changed my life in how I approached my business. And they were talking a lot about advertising, the response you get from that. You might run an ad and the phone might ring 20 times from that ad or 50 times. And you're going, wow, that was a really good ad because we got 50 phone calls. And you do a different one, but you only get 10 phone calls, but 8 out of 10 book. Whereas the other one, out of the 50 phone calls, only 5 people book. So which is the better ad? And the one, the 8 out of 10 booked, they spent $500, $1,000 with you, whereas the other one, they spent $150. So it's not just how much the phone rings. And that's why looking at your numbers of your business is so important.
And you have to know what numbers are important, because if you looked at this, the number of people who called, you'd say, wow, this one's so much better. But when you really dive into the numbers, you'll realize it's different. And sometimes, as medical professionals, we don't know the numbers as well. We don't know how to crunch the numbers and analyze them like a numbers guy does.
Yeah.
And so, what I used to do is when I was a smaller practice, I'd have someone come in and look at my numbers for me. And
Okay.
I'd have them analyze them, and they would look at them, and sometimes they would bring up stuff, and I'd be like, oh, I wouldn't have thought about it that way. That isn't important to me, but I see why you see it's important. And so, medical brains work different than, these accountants who have analytical brains.
Yeah. Well, some of my coaching clients, I do that with them. I will get certain figures from them each month on different aspects of the business. And just by looking at the numbers, there's things that I can actually see that they don't always see. But once they start doing it for a while, then all of a sudden it's like, to me, like you said, new patients coming through is an indication of the business and the business owner. Are they doing the right thing? But then you also got your rebooking rates. But are there any other main things that you actually look at?
I look at the per visit value.
Oh yeah,
So
it's a good one.
I look at, and if you guys don't know what that is, what you're looking at is, what are the charges for that visit? If you have a patient who comes in and they're just, low level visits all the time, you only be making, $180 to $100 a patient. Now, if they're getting a cam walker boot and they're getting crutches and they're getting a cortisone shot and they're getting x-rays, your visit may be maybe $500. And so what we look at stuff is I look at like what my doctor's per visit value is. And sometimes what I'll find is that doctors are rushing through visits. They're trying to get the patients in and out. They're not like looking at what else can I do to help this patient. They'll say, okay, well, let's just see how it is till next time. Just let it ride, versus offering them other solutions.
Yeah.
And so if you're just, billing office visits all the time and not really able to do much else for the patient, or not offering it, you're really losing an opportunity for income streams.
Yeah, and it's not that anyone's listening to this, it's not just we're being money focused. To me, it's that per patient value is a great indication of, is the podiatrist communicating with the patient in a good way, offering different services, because they're not going to say yes to anything if it's never offered to them.
Right. Well, and I look at it as, I call it the goodie bag approach. So out here, my daughter goes to a birthday party. At the end, she gets a little goodie bag. It's got some toys. She's already had some cake.
Yep.
They've played games. There's been a lot that's been offered to her during that time. So it's the same thing with my patients. If a patient comes in and they're in pain and I say, well, let's just watch it and see, the patient may say, well, the doctor didn't do anything for me today. And so, I let my doctors know that you should always offer something to the patient. If the patient, unless they come in and say, I'm doing great, doc, things are wonderful, I'm so much better, then you can let things ride. But, if the patient's still in pain, you need to offer them something, whether it's a different medication, whether it's, we're going to get you into an orthotic now. Would you like to do physical therapy? I've got this splint I can do for you. Why don't we have you do some stretches that you weren't doing before? You have to make sure that there's a value in each visit when the patients come in. Otherwise, I've had, where this happens where, again, I have a cross section of docs that were able to look with it. I've had patients call and say, I got charged $100 for this visit and the doctor didn't do anything. And I know the doctor did do stuff. They talked to the patients, they listened, but to the patients, a lot of times they need to feel like they got something. And
I agree.
sometimes it's just advice. And if you give them good advice and you get a smile after you say it and you get that receptive feedback from them, then you're fine. But otherwise, you need to have offered them something, another way to get their pain to where they want it to be.
Yeah, well, I think there's nothing worse than when I've been to a doctor, a physiotherapist, a chiropractor, any health professional, and when they say to me, let's just see how it goes, I'm like, well, I don't want to just see how it goes. I want it fixed. So,
because if you wanted to see how it goes, you wouldn't have come in.
Yeah, if I want to see how it goes, I'll just sit at home. Let's just see how it goes. And there's been times when I have had an injury and I say, let's just see how it goes before I get any treatment, because I know if I go somewhere, sometimes that's the advice that I'm given. Oh yeah, we'll check it out. Yeah, no, I don't think you need this or that. Let's just see how it goes. So yeah, it's terrible advice.
Every time. And
patients want to be guided. I think patients really want to be guided. What's the next step? What's the next step? And then if the next step is you're fixed, then that's an awesome step.
Absolutely. And I think you have to read your patient too. And there's times that some patients are hard to read. and I'll ask them, we'll get done with the visitor, I said, did I meet your expectations today? Was there anything else you wanted to talk about? Was there something you were thinking about treatment wise that I didn't mention? And I'll have someone say, yeah, I was reading online about doing platelet rich plasma injection. And I go, well, where you're at, that's not usually where I offer it at this stage of my algorithm, but we can talk about that and what that can do for you in this sort of scenario.
Yeah.
And so sometimes patients will tell you if you just ask. And from our end, sometimes it feels uncomfortable being like, is there something else you wanted? But for the patient, sometimes they're just waiting for you to ask them that question, or they want you to bring up something that they were thinking of. And if you don't ask it, if you haven't hit it, you don't ask, it's not going to happen.
Yeah, I think that's a really good question to sort of wrap up on is, when you're with your patient, is there anything else I can help with? Because sometimes it might be as simple as, well, actually, I was thinking about buying some new running shoes. What should I look for? And if you don't ask that question, they're going to leave and go, oh, I wish I had asked about the running shoes. And then they go and buy the wrong pair.
Yeah. Or they call back later.
Yeah.
And then they ask your staff the question, and then your staff interrupts you in the middle of the day. And then you wind up calling the patient back, and then you're on the phone with them for 20 more minutes. When all you had to do was just ask and give them a simple answer. Yes, buy this pair. I think that'll be great for your foot type.
No, that's fantastic. So, Patrick, before we wrap up, do you have any parting advice? I usually do this with you each episode. I deal with a lot of guests on here. Do you have a final tip for whoever's listening to this particular episode? Could be a life tip if you wanted to, but basically around business, because that's what we've been talking about.
I think one thing that's really important to being a good doctor is developing your staff. We get busy with patients. We get busy doing our charting. We get busy with our families. And sometimes we don't take the time to train our staff because, it's easier. I'll just do it myself. It takes longer to train them than it does to do that. But what you don't realize is that, the time you spend training, yes, it may take longer this time, but then they'll be able to do it for you next time. True. And the staff also values it too. I did this, I did a little exercise one day. I walked around clinic and I asked my staff, is there, I said, what do you like about working here? And I got all kinds of different answers, but one of my staff members said, she goes, you know what? She goes, I'm 60. She goes, I've been at other practices and they think I'm old and that I won't, I can't learn new things and that I can only do what I can do. And she's like, you teach me new things. And it's really why I like working here because you have developed me and I've become such better at my job, working with you guys. And so don't downplay the fact that a lot of the staff wants to learn, wants to develop, and wants to become better. And that can potentially be a job perk for you. It helps you, but it's a job perk for them that they're getting to develop their skills. I
think that is a fantastic tip to finish up on. So Patrick, I want to thank you for coming back on the Podiatry Legends podcast for your 5th time. And I'm sure I'll have you back and I will catch up with you in October when I'm in Chicago again, because we caught up last year and wasn't that a fun dinner? A fun lunch.
Was a great dinner.
Was it lunch or dinner? I can't remember. I think it was
an early dinner.
It was an early dinner that dragged on a little bit. But that was a fantastic. So I'm looking forward to doing that again. So thank you very much for coming back on.
It was great talking with you.